What you just heard was a magical composition penned down by a Belgian composer to salute the efforts of the doctors, the medical staff, even the Chinese people in combating the deadly novel coronavirus. WION continues to bring you the latest updates in the ongoing deadly coronavirus outbreak, and the latest data pouring in points out that China's Hubei province has recorded nearly 93 new deaths over the past 24 hours, bringing the death toll to a whopping 1,868. Over 1,800 new infected cases have also been recorded, which means that at this moment, more than 72,000 are suffering from coronavirus across mainland China. At this moment, there are 5 deaths recorded outside China from Philippines, Hong Kong, Japan, France and Taiwan. Now, China has hit a grim landmark as the official death toll from novel coronavirus mounts to 1,868. The COVID-19 has now triggered unprecedented quarantine efforts. Dangerous conspiracy theories have raised a global alarm. Few days ago, a report suggested that China was underreporting the number of novel coronavirus casualties and infections. A dramatic spike in casualties in Hubei province prompted China to revise its data methodology in regards to counting the infected and the dead. Now, yet another bombshell report has surfaced. Before we unpack that report, let's first ask the burning question. Did the Chinese authorities know beforehand about the catastrophic potential of COVID-19? And more importantly, did China hide it from the world on purpose? Why do we say this? A new report suggests that the Wuhan Naval University advised the Chinese National Health Commission to enforce a nationwide lockdown on January 5th. This is 15 days before the government officially declared COVID-19 as an epidemic. WION has accessed this damning report. It was published on January 5th, addressed to the National Health Commission. The Naval College was deeply concerned about a pathogen report of a pneumonia patient who later emerged to be patient 0. The Naval College pinpointed that this new virus was almost 89% similar to the SARS virus, and the Academy then issued a notice to Chinese authorities for immediate corresponding prevention and control measures in public spaces. Essentially, the kind of lockdown you see today in China. Now, the document for evacuation was issued on 5th January itself, but China declared it an epidemic only on the 20th of January. As COVID-19 continues to kill over 100 people daily, China faces international vilification and potential domestic unrest as it blunders through repeated cover-ups, lies and repression. It has already failed to stop the virus and may well be fanning the flames of its spread. This administrative crisis in China is now prompting global concerns about the reliability of epidemic data released by the Chinese government. Meanwhile, the international health community has tried to infer from the dubious official daily tallies just how dangerous the new coronavirus disease may be for the rest of the world. Trust appears to be waning inside China and is increasingly unraveling across the public health community. An epidemic cannot be fought and won unless the bonds of trust between governments and people can survive the grief, confusion, emotions and medical challenges of the battle. The Chinese government, in its negligence, has truly jeopardized those bonds, perhaps beyond all repair.